Hi, this is Dr. Derek Mahoney here to tell you about an exciting new program with EODO, which is called Skeletal Anchorage and Surgery. Now, what I'm teaching you in this program is not the classical approach to surgery, where a patient may have to go through orthodontics for 18 months before the teeth are ready for the surgery. I'm going to introduce to you surgical first, and I work with one of the top surgeons in Sydney, Dr. David Lycrum, who has refined this technique to make it very predictable. I'll also show you patients who possibly need surgery but don't want to take such extensive treatment. That's where skeletal anchorage comes in. We'll discuss here the one moon technique of MSE, so you can widen a palate in a non-growing individual, even use a face mask. If you look here at Epworth's envelope of discrepancy, you can see that there's only so far you can move a maxilla with orthodontics or with growth modification. Here we're talking about adult patients, so we've missed the opportunity of growth modification. So what I'm going to show you is how we could move their upper jaw and their lower jaw non-surgically with the help of skeletal anchors. We'll discuss the Beniplate system by my colleague Dr. Benedict Wilmers in Dusseldorf. We'll talk about OBS and the excellent work of John Lin and Chris Chan. And we'll show you how, with the help of placement of the TADs or the skeletal anchors in good quality bone, you can actually do a lot of orthopedic work in non-growing individuals. So if you have a practice that you're treating a lot of adults and they come in with severe class 3s or severe class 2s, big open bites, 100% overbites, I can show you how we can intrude teeth, such as molars to close an open bite, intrude incisors for a deep bite, reduce gummy smiles non-surgically. So it's a very good course if you are now tackling more difficult patients who clearly have a skeletal problem but don't want to undertake traditional orthodontic surgery. So it'll be myself, Dr. David Lycrum, and we'll be discussing case after case, showing you the planning, showing you what cases you do need to dentally decompensate and which cases are ready for surgery first. So please join me in October for this exciting new program. Please invite your colleagues that you work with, including your MaxFac surgeons who may be interested in learning more about the surgical first approach. Thank you. See you then.